What's up, veterans? Y'all know what it is. Gotta take a sip. But hey, today we're gonna be talking about C&P exam breakdown preparation for allergic rhinitis and chronic sinusitis VA rating. Y'all like this type of content? Let's get into it. First off, both of these disabilities are considered a Pact Act presumptive condition. So if you do plan on filing these two VA claims, or if you're currently in the VA disability claims process, this is going to give you some good tips on how to get service connected, as well as how to tap into the higher percentage when it comes to allergic rhinitis and chronic sinusitis. Both of these disabilities are considered high value VA claims if you do it right. Whenever you go into the C&P exam, every examiner should just have this DBQ out. Do not allow a C&P examiner to fill out an 8-page DBQ for sinusitis or rhinitis with a sticky note or two. You're going to do yourself a disservice. They're going to see if you got a diagnosis. More than likely it's going to be yes. Then we got 1 Bravo. Do you got chronic sinusitis, allergic rhinitis, or one of the other ones? Keep in mind, if you have bacterial rhinitis or the one right underneath it, granulomatitis. Bacterial yields 50%. The granulo yields 100% VA disability rating alone. So if it applies to you, very rare veterans and people have this. But most veterans are going to be seeking chronic sinusitis and allergic rhinitis. VA symptoms on here as well, but it does play into more of your rhinitis issues. It started in your active duty time, depending on your deployment, whether it was Afghanistan, Iraq, Dubai, Kuwait, Africa, Djibouti, Egypt, if you was flying across the airs in the Middle East, or if you was on the sea in a naval ship, submarine, if you was skipping on the kangaroo, you want to take care of this. Or, you over there chilling on the white sand beaches with the camels. Talk about it. Talk about when you started experiencing the issues. Talk about when you started going into medical. If you didn't go into medical, you definitely need to capture this on a personal statement. You don't need an in-service complaint or diagnosis because these are considered Pact Act presumptive conditions. However, you still need diagnosis, and you still need to explain, a little detail, either in person at the C&P exam, if you make it there, depending on your medical evidence, or in a personal statement backed up with buddy statements. I always recommend veterans to submit all claims with a statement. Next, most important part in this DBQ is going to be the sinusitis issue. A1, pretty much where's the location of your sinus issues. A2, does a veteran currently have findings, signs, and symptoms attributable to chronic sinusitis? Obviously going to be yes. Everything may apply. If not, possibly a few things, but you definitely want to point out anything if it's missing. Make sure the C&P examiner have the DBQ out, as well as if they ask them, have they reviewed your medical evidence. If not, you definitely want to be like, okay, well, I brought everything in with me, so let's go over it right now, because I'm not going to leave this exam half-ass on a sticky note. Moving on, A3 and A4, non-incapacitating and capacitating episodes when it comes to chronic sinusitis. Now, if you've been into the hospital, if you ER, minute clinic, see your doctor pertaining to this, this is what the VA is looking for when they're trying to establish your percentage. If you do have any incapacitating episodes, that's going to unlock the door for the higher percentages above 20%. Prolonged periods, 4 to 6 weeks of continuous antibiotic treatment in the past 12 months. They're really just looking at the last 12 months. Yeah, you could bring up issues from outside of that. However, I know a lot of veterans, as well as active duty, we don't like to go into medical. But if only started gathering medical evidence the year prior to that claim, and then, you may have to wait a couple of months because the Pact Act presumptive conditions are processing slow. And then, 6 months has passed, you're going into a C&P exam, you have nothing to show. They're going to go off of the last 12 months, which is 6 months, you were good. 6 months prior to that, maybe 2 months of that, you had an incapacitating episode. So we're going to service connect you, but it's not that serious. So when it comes to that, okay, why did you stop at the once you hit submit? If you're having an issue and you want to build that medical evidence, you want the best VA rating possible, you got to stay in medical. If you're having episodes of sinusitis issues, take your ass to ER, Minute Clinic, document it, especially for chronic sinusitis. Allergic rhinitis is a little easier to get, and we will get back to that. Chronic rhinitis, okay, B1 through 3. Pretty much they're talking about nasal obstruction, and that's the main thing that deals with rhinitis. Do you have any blockages in your nasal canal? Nasal endoscopy for allergic rhinitis is going to be your best friend because it's going to show any signs and symptoms of a deviated septum, as well as any nasal blockages, mainly pertaining to this question right here where it says, okay, is it greater than 50% on both sides? Yes or no? If it is yes, yes. If there's complete obstruction on the left side, on the right side, and moving on. Is there permanent hypertrophy of the nasal turbinates? But the next important question on here is going to be B5. Are there nasal polyps? If you just have a regular VA claim for allergic rhinitis, it's either going to be a 30% with polyps or a 10% without polyps. And that, my friend, my veteran, my comrade, my battle buddy, that is the difference between 10 and 30. Yes, all the other medical evidence comes to rating purposes that VA rater is going to be looking for that box. Okay, 30 right there. Okay, Gucci. And moving on to the next one, you got the granulo conditions. Granulo is 100%. It's either going to be 20 or 100 when it comes to the granulo motherfucking rhinitis. So if you are one of those rare veterans that have the Galactus level rhinitis, you can get 100% for it, but you're definitely going to need some good medical evidence, obviously a diagnosis, and moving on. This DBQ cuts down from an 8-pager to about a 5-page DBQ for the veteran who is going for both allergic rhinitis and chronic sinusitis. If you are filing for both, definitely make sure you have a diagnosis for both, medical evidence that can support you getting service connected for both, as well as your medical evidence showing, and your doctor, treating physician, showing that they can identify, okay, whenever you're having an allergic rhinitis episode, it's just that. Whenever you're having a chronic sinusitis episode, it's just that. Comment, leave some feedback pertaining to the video, as well as mainly pertaining to your personal VA disability claims process journey. And as always, 2023 year to vet. Stay Gucci with it.